I'm a dentist who's passionate about helping patients with tooth wear. I spend a lot of my working day managing smiles that have been damaged for various reasons, and patients often ask me what causes tooth wear. Well, there's a variety of causes. It's either going to be some sort of chemical attack on teeth, usually acid erosion, or it's going to be some sort of grinding effect where teeth are rubbing against each other and wearing away for that reason. Sometimes that can just happen by virtue of day-to-day contact in patients with slightly crowded teeth. In some cases it might be stress and clenching and grinding that's causing tooth wear patterns. So when you first see me, we put our dental detective hats on and we look at photographs and digital scans, and we come up with a diagnosis along with a self-assessment questionnaire from you that explores some of the things in your lifestyle that might be contributing to your wear patterns. We do a detailed look at your medical history. Are you suffering from gastric reflux, for example, which can cause acid erosion of teeth? Are you taking medication that's causing dry mouth? With the absence of saliva or even a slightly reduced saliva flow, we can see increased tooth wear. What about health diets? The lemon juice and water diet or the apple cider vinegar diet, both absolutely devastating to teeth. And I've seen, men and women who've come in, started those diets, done them for 2 or 3 months, and even over that short period of time, we're seeing enamel dissolving, teeth getting sensitive and yellow, and permanent loss and damage to the teeth. So it can come as a really big surprise. And I would suggest that if you really insist on doing those diets, and I know they're huge around the world for health reasons, that if you're doing the lemon juice and water diet, you only ever drink lemon juice through a straw. You don't drink it through a cup, and you follow up with a rinse with some soda water or something that shifts the chemistry of your mouth into a healthier zone for teeth. With the apple cider vinegar diet, things are sort of doubly effective on teeth because you've got acetic acid from vinegar and then you've got sugars from apple juice, and the combination will cause, sometimes in a susceptible patient, both erosion, acid erosion, and tooth wear plus decay. So you can buy tablets that provide you with those dietary requirements from the apple cider vinegar diet, and I would encourage you to move away from drinking and take the tablets instead. One of the most important things you mustn't do is constantly sip acid drinks, and that applies to sodas, energy drinks, lemon juice and water you would not carry around in a pump bottle, for example. Drink it all day, because you're refreshing. Every time you do that, you're refreshing your mouth with a fresh acid solution that's dissolving even more tooth structure. So if you're noticing that your teeth are sensitive, that are a little bit yellow, that your bite's changing a wee bit, come and see me, come and see your dentist and find out whether you might be suffering from tooth wear. We'll run you through a risk assessment and an analysis and give you some really good strategies for managing it. It might be that we have to rebuild your teeth if the damage has been severe, but it might also be that we just put some really useful preventive strategies in place for you. And in the bio, I've got a link to a little blog that I've written about some of the useful things that you can do to help protect tooth enamel and stop it from wearing away. So I've been asked how much tooth wear is normal, and that's a really good question. There's some very good scientific studies that have measured tooth wear over time, and a couple come to mind that describe losing naturally in a healthy mouth about 1 millimetre of tooth structure every 70 years or so. So if you've lost more than 1 millimetre of tooth structure and you're only in your 30s, something is going wrong. There's a force imbalance. Either there's some chemical attack on your teeth that's dissolving your teeth, or your teeth are getting some sort of frictional contact, either in just day-to-day activity, or maybe you're grinding your teeth at night that's causing that problem. It might be that you've got acid reflux without realizing it, and we work really closely with medical specialists and doctors sometimes to get to the bottom of the cause. So if you're noticing that your teeth are changing, that they're shortening, thinning, or getting worn in some way, maybe you're noticing that they're getting yellower over time. And while teeth do darken a little bit with age, they shouldn't be yellowing significantly between the age of 20 and 40. It usually means that you're losing enamel from your teeth somehow, typically through acid erosion, and the underlying yellower colour is starting to shine through because the enamel's getting thin. So these are all the little clues, the diagnostic clues that we pick up when you come to somebody who knows how to manage tooth wear. As a DSD clinic, and the only one in New Zealand, we're using diagnostic tools, digital tools, to really map closely what's going on. And one of the other amazing things we can do is with digital scanning, we can scan you now and we can scan you in 12 months' time and actually assess whether we can marry those scans together. We call that patient monitoring, and look to see how much tooth structure has changed, whether the tooth wear is active or whether it's something historical, and do we need to be worried about it. So dentists have an incredible diagnostic capability in this area. Reach out, ask us if you're worried, we'd love to help. Can tooth wear be reversed? Well, sadly, no. We can't grow enamel back at the moment. There's no science that allows us to do that. What we can do, though, is we can put artificial enamel back using materials like composite resin and porcelain. And so when a patient comes to see me with tooth wear, particularly severe tooth wear, the first thing that brings them in is usually a change in their smile. So what they notice is that the beautiful curve that's created by the edges of the upper teeth against the lower lip is lost, and they'll often end up with a reverse curve. They'll notice that the edges of the front teeth are getting transparent and see-through and maybe starting to get a little raggedy and chip away. When we look closer at the rest of the mouth, we often see the wear has translated to the biting surfaces of teeth as well. And what we also find is that the bite tends to close up, so the patient ends up getting a little shorter in the face from nose to chin. And so one of the things about managing tooth wear is knowing how to re-engineer that bite and being able to give patients solutions that are both cost effective and also based on a really well-designed blueprint. As a digital smile design clinic, what we do is we gather digital records and scan you, send everything up to the Digital Smile Design Planning Centre in Madrid, and then design and engineer that new bite. We bring you back, we try that in with a DSD test drive and mock-up and really test the bite. Sometimes we use a little thing called a deprogrammer for bites that have really been affected badly, and we want to allow muscles and joints to relax, the lower jaw to find a comfortable resting place, and particularly where we're opening the bite quite a lot, we want to know that that's going to be comfortable for you. So we'll test first, and then we'll design, and then we'll produce a result in some different materials. The thing I love about digital dentistry is that we've now got amazing materials that we can use. Materials that we can either 3D print or we can mill with a machine, and a wide range of costs. So while the concept of re-engineering a bite, and sometimes that means building up every bottom tooth to add more height where it's been lost, as well as lengthening front teeth that have been damaged, sounds like a major project. It can be very cost effective with some of the materials that we've got. And we're also able to phase treatment. So patients will say to me, can I just build up 1 or 2 teeth that are worn at the bottom? And I say, no, not really, because it's like walking on one stiletto and one flat shoe. We kind of need to re-engineer the whole platform of biting so that everything meshes properly. But we can do that with what we call transitional materials, cost-effective solutions based on our design blueprint. Open the bite, so do a bite lift, and then convert that in years to come once we've got you stabilized, tooth by tooth or 2 teeth at a time or sections at a time in a very affordable way. In severe tooth wear, really the best treatment solution is to use porcelain restorations because they're long lasting and really hard wearing, and on back teeth where there's a lot of force, a lot of chewing force, you need the strength of porcelain. But with our transitional materials, we're making that very cost effective for patients and helping many patients who otherwise felt that their case was really hopeless and that there wasn't a solution for them. I think that's the thing that gives me so much joy in these tooth wear cases, is the ability to really change somebody's life, both in terms of how they feel about their smile and the self-confidence that they gain from having their smile restored, but also managing some of the side effects of tooth wear, which are extreme sensitivity, having to avoid foods and drinks that cause your teeth to ache, and we can add comfort and we can add function back to a patient's life, which is really life-changing.